This PowerPoint talk about the epidemiology in community health nursing.
In this narrated lecture, you'll be learning about the field of epidemiology as it relates to community health nursing. You're going to learn how to calculate rates and engage in prevention practices to improve the health of population groups in the community. The definition of epidemiology is essentially the study of the distribution of determinants of health like disease and chronic conditions related to the events in a specified population and the application of this study to the control of health problems.
Okay, so the epidemiology, it is a Greek word. Epi means on or upon, demos means people. So the survey or any kind of study on a particular group of population in particular geographical area. So the study of distribution and determination of the health related to the events in a specific population and application of this study to the control the health problem. Example, if I say like we go for survey a particular areas. Let me tell you. Like I said, this is the geographical area. And imagine this is the one of the small community. And out of this community, maybe 1,000 people are live. So you make a team and go for the survey or ask some questions or tell them, okay, you have a high blood pressure, what medication you are taking. And then you do a survey, what are the output or what are the improve their health, right? So the study of distributions and determine the health related events in a specified population. That is events in a specific, okay, and also application of this study for control of health problem. So what is the effect of this? Then you can use it for further study or you can apply it for other population. This is actually epidemiological studies.
In a specified population and the application of this study to the control of health problems. Epidemiologists search for causes and other factors that influence.
So epidemiology is a study, right? But the person who did it or who specialized on it, we call epidemiologist. So epidemiology is such for the cases and other factors that is influences health related events. And always you can ask how and why, and you will get the answer.
Influence health-related events. They provide the how and why of events by comparing groups with differing rates of disease occurrences, differences in demographic characteristics, genetic or immunologic makeup, behaviors, environmental exposures, and other risk factors. So let's explore a real-life case of how epidemiologists found a new disease condition. This first case happened back in the 1979-80 time frame, and there was a physician in New York that reported to the Centers for Disease Control and Prevention that he was seeing an increased incidence of Kaposi sarcoma in his patient population. In addition, the presentation of the disease appeared to be different than that was normally seen. There was also a physician in San Francisco at about the same time that reported to the CDC that he was also seeing an increased incidence of Kaposi sarcoma and pneumocystis carinii. So an investigation was begun.
Okay, so what we saw here, this is the epidemiology case study one. And pneumonia, they strike the gay male. So first, particularly, this is the project name. a physician in New York, and reported to the CDC, disease control, that he is seeing an increase the incidence of Kaposi sarcoma in these patient populations. Incidence means new cases, right? In of the Kaposi sarcoma in this patient population. In addition, these presentations of disease appears to different than the normally seen. In the same time, another physician in California report CDC that he also see an increase the incidence of Kaposi sarcoma and pneumocyte canary. So this is the organism can cause pneumonia. So they try to link up between this organism or pneumonia patient with a skin cancer Kaposi sarcoma. So an investigation is begun. Why?
Incidence of Kaposi sarcoma and pneumocystis carinii. So an investigation was begun. Here is a table that explores the cases of Kaposi sarcoma before the 1979 to 1981 distribution of cases. They're doing a comparison between 1961 to 1979 and then 1979 to 1981, where you can see the number of cases clearly jumps and is excessive in comparison to what it had been. And then an investigation of the average age affected. It's a very much younger group of patients. And then their mean survival time is much shorter. It's only 2 years instead of 8 to 13 years. And all of the cases were homosexual, whereas none had been before that. And the average number of sexual partners was 85 compared to just one sexual partner in the years preceding that. This table explores how many of the cases were men. So in the first year that it was examined, in 1979, all 10 of the cases were male. In 1980, all of them were male. There were 26 cases and 26 were male. The next year, 71 out of the 72 cases were male. And so this was suggesting that there was a male-to-male transfer of the condition. So they had to sit back and think, okay, what do we know to start out with? We know that 80% of the cases were happening in California and 20% of the cases were in New York. The cases were dramatically increasing. Almost all of them were male. Almost all of them were homosexual. They also determined that the age at onset of Kaposi sarcoma was much younger than usual, and that the mean age of survival after their diagnosis of Kaposi sarcoma was much shorter than usual.
Okay, so
at this point, they...
So what you see or what you learn from this, remember in this discussion, talking about the Kaposi sarcoma or pneumonia or homosexual male, because the scientist or doctor do a epidemiological study in a particular population, they were homosexual practice or gay people, and they found a relationship between pneumonia and Kaposi sarcoma with homosexual group. And after that survey or study, they came a solution and they said 80% cases in California and another is New York, right? 20% cases in New York study. But remember, it is not a general views in that study. And after the summary, they said cases is increasing. Almost all patients are men, and also they have a history of homosexualities, right? Means they are gay. Also, age or onset of Kaposi sarcoma is increasing younger than as usual. And mean age of survival after the Kaposi sarcoma is much shorter than as usual. So you see, these are really worse than the as usual who are not in this group or not practiced like this or who is not pneumonia and Kaposi sarcoma together.
Was much younger than usual, and that the mean age of survival after their diagnosis of Kaposi sarcoma was much shorter than usual. At this point, they made a new diagnosis for an unknown viral disease, and they called it the gay-related immunodeficiency, or GRID, which we now know today as HIV and AIDS. In 1982, they renamed it HIV because they found that the disease was not specific to just gay men, and so they changed the name of it. But that's how they started the investigation.
So you see, and then another study, and they changed their mind now. Okay, so it is not related only the homosexualities. It is related to the any kind of other immunodeficiency status as well, and they changed the name
into what we know as today's HIV and AIDS epidemic. This is another case that happened here in Indiana a few years ago in Johnson County, when a patient that was 2 weeks old presented with diarrhea, a mild fever, vomiting, and dehydration. The doctor started fluids and antibiotics on this baby, but the patient developed cardiac irregularities, went into a coma, and died. Blood studies showed an infection with salmonella. The cultures were sent on to the Indiana State Department of Health, and they identified the serotype as being Salmonella puna. That didn't really have any significance at that point. But they had to stop and think, okay, what do we know about this case? Well, they knew that it was an extremely young infant, and that infant had been doing well up until the development of symptoms 3 days prior, and that the S. puna subtype is only seen in reptiles. 3 weeks.
Okay, so now these studies, let me tell you something. Epidemiology case studies too. Patient in 2 weeks old, they got a patient, is infant, only 2 weeks old. Infant present with a diarrhea, mild to no fever, vomiting, and appears dehydrated. So 2 weeks baby, diarrhea and vomiting means dehydrate, and dehydration lead to the shock. And fluid and antibiotic initiated. So definitely doctor give the fluid replacement and antibiotics because of bad diarrhea or what are the underlying cause. Maybe they do not know at the very beginning, but if they want to save the life, they have to start the medication. Whatever it is, they collect the specimen and they found the organism. It is called Salmonella puna. Patient develops cardiac irregularities and goes into coma and passed away. So blood studies show infection with Salmonella. Salmonella is one of the most important organisms that can cause diarrhea. But Salmonella has several types. So here the culture stand identification, it is subtype are Salmonella puna, right? It is another subtype that can causes this condition for the patient. And next, the extremely young infant, because only 2 weeks old infant doing well until 3 days prior. And also they found this Salmonella puna subtype only seen in reptiles.
But they had to stop and think, okay, what do we know about this case? Well, they knew that it was an extremely young infant, and that infant had been doing well up until the development of symptoms 3 days prior, and that the S. puna subtype is only seen in reptiles. 3 weeks later, another single case of salmonella in a young infant was reported from a Johnson County hospital. 2 days later, another physician reported a salmonella case in another young infant, and that infant was hospitalized. That same day, another infant from a different hospital in Johnson County was diagnosed with salmonella. The cultures were...
So you see something? So 3 weeks later, another single case of salmonella in a young infant is reported from Johnson County Hospital. So in the same geographical area, more than 2 or 3 patients coming with the same organism, right? It is a particular area, particular population, same organism. They need to study. Maybe it is new, or they learn it and implement it for further study or for further management. And this is epidemiological study. 2 days later, another physician report salmonella case in another young infant. An infant is hospitalized. Same day, another infant from different hospital in Johnson County. So geographically it is same. Diagnosed with salmonella too. So maybe contaminated from same water or something same, right? It is transmitted, and also cluster sent to for lab
were sent
studies.
on to the Indiana State Department of Health lab. The lab reports confirmed that it was salmonella and that the subtypes were Salmonella puna and Salmonella marina, both of which are only seen in reptiles. So this was significant. An investigation was performed.
So what are the final report? After the lab report study, they found this is salmonellosis, right? Means diarrhea or vomiting because of salmonella infection. But this time they got a new species, and this is called Salmonella puna and Salmonella marina. And these two species or subtype is transmitted only through the reptiles. 90% of all reptiles normally contain salmonella in their gut or in their skin. So I'm talking about the Florida because I'm from Florida. In Florida, our weather is not too cold, not heavy rain, and it is very sunny all the time. If your house or the environment is very favorable for reptiles, and these reptiles like to stay in water, but they came out in sunny day, your garden, or they touch your yard, or you planted something, they eat, and they actually put it their saliva, and saliva contain salmonella. But you do not know that when you put these vegetables from your yard, you also be concerned to boil it properly. So reptiles carry always salmonella.
Subtypes were Salmonella puna and Salmonella marina, both of which are only seen in reptiles. So this was significant. An investigation was performed. When they went to the homes and did home visits, they found that the homes of the patients were relatively affluent, and they also found that the mothers had washed the baby bottles and or their babies in the kitchen sink. And then upon further investigation, they found that the Johnson County Fair had been held previously and that chameleons were given to children as prizes, and that those cages that the chameleons lived in had been washed out in the kitchen sinks prior to a baby or a bottle being washed there. So the mode of transmission was from the kitchen sink to the baby. So Outbreak investigations start with confirming that there's an epidemic. An epidemic is when there's our case numbers clearly are above their normal rate. Then signs and symptoms are confirmed, and cases are described by person, place, and time. And then a hypothesis is built and tested. And then interventions are developed and tested. In epidemiology, we use rates to express the extent of disease in population groups.
Okay, so first of all, if we go a little back here, so what are the some relatively affluent homes? Mother wash their baby bottle and infant in the kitchen sink, result of investigation. So when the same cases reported to the hospital, that is they need to survey more. What are the underlying causes? So they should try to go to find out what are the agents, what are the host or environment. So 1, 2, 3, right? These three triad consist of external agents, and also it is susceptible host or environment that is begins the host and agents together, right? So like I said, the organism cases came from reptiles, and then the host is infant, right? And environment is the surrounding areas. So in this model, disease results from interaction between agents and susceptible host in an environment that is support the transmission of agents from a source of the host. So this is the important to go for investigation further.
And that those cages that the chameleons lived in had been washed out in the kitchen sinks prior to a baby or a bottle being washed there. So the mode of transmission was from the kitchen sink to the baby. So outbreak investigations start with confirming that there's an epidemic. An epidemic is when there's our case numbers clearly are above their normal rate. Then signs and symptoms are confirmed, and cases are described by person, place, and time. And then a hypothesis is built and tested. And then
okay, so what she said, build and test hypothesis. So up to this lecture, and if you listen her voice, you can get a concept of disease occurrence, particularly about the epidemiology. After all of the survey, we confirm that it is an epidemic, right? Because so many people are reported to the hospital, their baby has diarrhea and vomiting, and laboratories found the salmonella subtypes, right? And confirm the sign symptom. I said vomiting, diarrhea, mild to moderate fever. And also the person plays the time, build the test hypothesis. So the outbreak investigation, and also what are the hypotheses. So the basic concept of epidemiology, we get, always remember, the critical or the concept of epidemiology is the disease and other health events do not occur randomly in a population. So they are doing everything to stop the salmonella subtype infection to Johnson County, right? This is the concept of epidemiology. So they try to event do not occur randomly in the population. but are more likely to occur in some member of population that other breaks the risk factor that may not be distributed randomly in population. So this is the kind of hypothesis for this survey. So develop also test in intervention is important.
Then interventions are developed and tested. In epidemiology, we use rates to express the extent of disease in population groups. So rates are a measure of the frequency of a health event in a defined population during a specified time period. So for an example, it would be the number of cases of influenza at Anderson University in February. They're calculated as the number of cases occurring in a period of time divided by the number of people at risk during the same period of time. And then you multiply that times any base multiple of 10 that results in a rate above the value of 1. So why are rates used? Well, here's an example. This year, if we had 100 cases of syphilis in our county with a population of 750 people at risk, this would indicate a serious problem. Compare that to 100 cases of syphilis in a major city with a population of 750,000. This would be a very low rate. So rates take the size of the population into account.
Okay, so like this, the extent of disease in a communities. Measure the frequency of a health events in a defined population during a specified time period. So what you learn? We learn that when you go for the survey in epidemiology, we have to count down the population and also the specific period of time when, right? And also health events. So I'm saying when we go for a summarize or a calculation, we always keep note, we need a health events, we need a particular population or defined population and specific period of time. So we describe also the causations of harm of agents, host, and environment. Like case occurring in a particular time, like the case occur in between January 2021 to November 2022. This is the period of time of population at the risk during the same period of time. So definitely when we go for this, we have to know what are the agents, host, and environment. For each of the following risk factor for particular case, we need to evaluate. So let me tell you again, for each of the risk factor and health outcome, identify whether they are necessary causes or sufficient causes or component causes. Risk factor and health outcome we have to evaluate. Again, I said, example, what are the health events? Means hypertension or shock, right? Or any kind of, like this previous case, salmonella, Tepoma, or Merina subspecies infection, right? Or any kind of like Treponema pallidum or syphilis. Also, we need to know what kind of personality or heart disease it is a risk factor, or even that's if we go for any kind of survey, skin cancer, it is important to evaluate, right? So next.
A note about the denominator. Remember that the denominator is the number of people at risk. In this instance, it was the entire population of Anderson University because anyone can get the influenza. But if you're looking at ovarian cancer, you just have the total number of women in an area listed. Here's an example of how we calculate rates. We have Brown County for a one-year period that has an AIDS rate of 17 cases and 114,000 population. We multiply that times 100,000 and we get an AIDS rate of 14.9 cases per 100,000 people. Compare that to Orange County for the same one-year period. Their AIDS rate is 156 cases divided by 1.2 million people. And we multiply that times 100,000 and come up with an AIDS rate of 12.3 cases per 100,000 people. So, as you can see, Brown County actually had the higher rate of AIDS at 14.9 cases per 100,000 people than Orange County, which had 12.3 cases per 100,000 people, even though Brown County had fewer cases than Orange County.
Okay, so this is a wonderful explanation. I believe everybody can understand it. It's very easy way to explain or calculate the ratio and rate among the Brown country and Korean country. Whatever it is, I want to tell. So when we go for any kind of epidemiologic calculation of rate, we have to keep in mind the three main elements need to describe in epidemiology. Okay, epidemiology cover the time, the place. So you see the Brown country or Orion county, and also person, right? Person means total population here, like here, 1,000, 100,000 population. So also complying and analyzes data by time, by place, by person, and is desirable for several reasons. So after this countdown, we found the AIDS rate is a little bit higher in the Brown County rather than the Orion County.
Incidence rates measure the pace at which a new illness occurs in a previously disease-free group of people. So an incidence rate is calculated as the number of new conditions occurring in a period of time divided by the population at risk during the same period of time, multiplied by a base multiple of 10. So this is a measure of the probability that people without a certain condition will develop that condition over a period of time.
Okay, so this called incidence rate, right? So incidence rate measures the place at which the new illnesses, such as AIDS, occur in a previously disease-free group of people. So what we learn from here, we learn what is incidence rate. Then we will talk what is the prevalence rate. So incidence rate, a description of the new quickly disease occur in a population, means new cases. It is based on person and time, so it has some advantage over an incidence proportion, because the person and time is calculated for each subject, and it can accommodate the persons coming into and leaving the studies. So what are the formula they use? Number of new condition occurring in a period of time, right? Population at the risk during the same time or same period of time, and multiply base multiple of 10. So how do you calculate the person time incidence rate? Person and time incidence rate, which are also known as incidence density rate. Keep it note, right? And this calculation are determined by taking the total number of new cases of n events, and it should be divided by or divided that by the sum of the person time of the at the risk population. Like few minutes ago, we saw it, right? How many cases and divided by the particular population number. So incidence rate. So again, I want to recap it one more time. I want to tell you the incidence rate refer to the rate at which the new events occur over a specific period of time. Or I can say incidence rate is the number of new cases within a time of period as population of a number of a people at the risk for the disease. And this number is called denominator. What next?
Time divided by the population at risk during the same period of time, multiplied by a base multiple of 10. So this is a measure of the probability that people without a certain condition will develop that condition over a period of time. Prevalence rates, on the other hand, are used to measure the total burden of a condition or illness that exists in a community. It's calculated using the number of existing conditions or events occurring in a period of time, divided by the population at risk during the same time period, and multiplied by a base multiple of 10. So both incidence rates and prevalence rates are measures of morbidity or illness. With knowledge of the prevalence of morbidity within.
Okay, so now talking about the prevalence rate. So prevalence rate used to measure the total burden of condition or illness that is exist in a community, right? So prevalence, or sometimes we refer to prevalence rate, and it is the proportion of persons in a population who have a particular disease or attribute at a specified point in time or over a specified period of time, right? So next here, how we calculate it. The number of existing condition or event occurring in a period of time. Incidence is a new case. Prevalence is an old and new case together. In a period of time, population of the risks during the same period of time, and multiply base multiple of 10. So how we calculate prevalence? To estimate the prevalence, also epidemiologist is randomly select a sample, like I said, stroke or hypertension, or few minutes ago we saw the pneumonia or salmonella typhi or Kaposi sarcoma. This is I call sample. So from the entire population, they want to describe or they want to evaluate. And also for a representative sample, sometimes they like to explain or describe. So prevalence is the number of people in the sample with the characteristics of interest, basically. And this number divided by the total number of population in a sample. The population of the risks during the particular period of time, right? So if I say why prevalence is important in epidemiology, the prevalence is often used as it reflects the burden of disease in a certain population. And this is not then limited to a burden in the term of and I said it does not mean to spend too much cost. Okay, it also reflects the the sample or the disease in a term of life expectancy, morbidity, quality of life, or other indication.
the population at risk during the same time period and multiplied by a base multiple of 10. So both incidence rates and prevalence rates are measures of morbidity or illness. With knowledge of the prevalence of morbidity within a population, nurses and other healthcare professionals can plan for services to meet the needs of the community. They help us to determine the necessity for facilities or programs and staff to address the problem and develop targeted interventions. For instance, if prevalence rates of STDs tell us that middle schoolers aren't typically sexually active yet, we can target this age group with education and prevention efforts and save screening and intervention efforts for high schoolers or college-age kids.
So here, what are the prevalence rate? Prevalence rate used to measure the total burden of condition or illness that is exists in a communities, right? So prevalence, sometimes we also refer, I said prevalence rate, and it is the proportion of person in particular population.
Screening and intervention efforts for high schoolers or college-age kids. Here's a practice problem. In Pretend City, between January 1st and December 31st, there are 35 new cases of AIDS that were diagnosed. There were a total of 300 cases on the list of active cases on December 31st. The population of Pretend City is 400,000. So calculate the incidence rate and the prevalence rate per 100,000 during that year. Now, note that when you write the answer, you have to be sure to write the number and then add per 100,000. Otherwise, the rate means nothing to the reader. So they might be asking, is it 75 cases per 100 population or 75 per 100,000? Also, you should know that the new cases are already included into your number of existing or active cases. Go ahead and calculate those rates. This is the epidemiological triangle that we use to try and prevent the spread of a disease. We work to kill the agent or protect the host from contamination or alter the environment so that the two never meet. And we do this through post-exposure prophylaxis or treatment of patients. We do it by recalling or destroying contaminated food. We give educational information so that a person stays away from contamination or illnesses. We close eating establishments if they are proven to be unsafe. We exclude people from work or school or daycare if they are ill. And we also do it by making public announcements.
Okay, so here.
So let's look at a historical.
Here showing a model, right? So option for prevention of spread. How we can prevent it? So post-exposure prophylaxis and treatment, recalling and destroying the food. So example, post-exposure prophylaxis might be wash your hand is a well practice, because washing hand properly is one of the most important and effective way of stopping the spread of infection and illness. So washing your hand thoroughly using the water and plain water and soap, and use the soap, right? So when wash your hand thoroughly using water and soap, so at least 20 minutes, and also dry them properly. So if you follow this one, you can spread 95% infection control. What are the other methods? Beside of hand hygiene, we use personal protective equipment like gloves or masks, eyewear, right? Respiratory hygiene, This is also way of prevention the spread of infection, or providing educational information, closing the establishment, and also exclusion from work, daycare, school, making the public announcement. So this is the different way we can prevent the uh, prevent the or stop the prevention of infection. Like vaccination is one way. Avoid touching anything or animals, or stay home during the epidemic or pandemic times.
To be unsafe. We exclude people from work or school or daycare if they are ill. And we also do it by making public announcements. So let's look at a historical perspective of how we fought disease in the United States over time. Starting back with industrialization in the late 1800s, there was a shift of people from the country to the city, and we also had a lot of immigration at that time. So those things led to overcrowding and inadequate public water supplies for the number of people who lived there, and also inadequate or non-existent waste disposal systems. So in 1900, the three leading causes of death were pneumonia, tuberculosis, and diarrhea. All of those are communicable diseases. And then during the early 1900s, 40 of the 45 states established health departments that began working on public health by improving sanitation and hygiene, by preventing infection through the provision of clean drinking water. In 1918, one of the most devastating epidemics in history occurred. It was the 1918 influenza pandemic that resulted in 20 million deaths, including 500,000 people in the United States alone in less than a year. Animal and pest control contributed to disease reduction. For instance, malaria used to be endemic throughout the southeastern United States, but regional mosquito control programs reduced this to a minimal level. In the 1930s through the 50s, we saw substantial improvements in disease prevention activities, including sewage disposal, water treatment through chlorination, food safety, solid waste disposal, and public education about hygiene, like food handling and hand washing. In the 1940s, penicillin was developed for medical use for the United States military to treat their soldiers. In 1955, the Salk poliovirus vaccine led to federal funding of state and local childhood vaccination programs. In 1962, the Vaccination Assistance Act was passed, which has been renewed continuously ever since. Because of this, there's been a virtual elimination of diseases that were very common in the United States at that time, including diphtheria, tetanus, polio, smallpox, measles, mumps, and rubella. However, it has to be noted that we may see a reversal of some of this progress because of people refusing to vaccinate their children. So fast forward to the year 2000, in which the three leading causes of death were heart disease, cancer, strokes. All of those three things accounted for 67% of all deaths in the United States. So over time, our emphasis has had to shift from the investigation of communicable diseases to determining the role of behavioral risk factors, environmental risk factors, and also preventing disease, disability, and death from chronic illnesses. In Indiana, we have higher rates of death from most chronic diseases compared to the United States. Our top three leading causes of death are heart disease, stroke, and cancer. And we have some major risk factors. We're the fourth highest obesity rate, and we have the sixth highest smoking rate. And we know all of this because we track health and conditions using a wide variety of data sources. For instance, our vital statistics, which contain our birth and death records, hospital discharge data for those people who are in the hospital for 24 hours or more. We have a national notifiable disease network where we have notifiable diseases that vary from state to state. We have 55 in Indiana, but there are over 100 in California that that are notifiable diseases. And then the census, we use that data because it gives us the denominator for our rates that we calculate. We track morbidity and mortality reports, and the CDC publishes a weekly report called the MMWR, the Morbidity and Mortality Weekly Report. And you can see the other ways that we get our data listed on the screen there. So how does epidemiology fit?
Okay, so here we see what the epidemiology provide data for directly public health action or translating data into the information into the action. What are the common data sources? Vital statistics, birth and death record, hospital discharge data, notifiable diseases, or census or morbidity and mortality report. So basically, if anybody asks you what are the data sources in epidemiology, the example of sources of secondary data that are commonly used in epidemiology. All of these are secondary data. And secondary data or epidemiological study include the birth and death certificate or population census record, patient medical record, disease register, or insurance claim forms or billing record, public health department case report, or survey of individual record, right? So basically there are two types of data we used in epidemiology. Epidemiologist basically provides sufficient evidence to take the appropriate control and prevention measure. And also epidemiologic study fall into the two categories we called, and we experimental and observational. So this source of data can help for further studies.
Track morbidity and mortality reports, and the CDC publishes a weekly report called the MMWR, the Morbidity and Mortality Weekly Report. And you can see the other ways that we get our data.
Okay, sometimes if anybody asks you, oh, what are the primary data and what are the secondary data, right? Let me tell you, data can be gathered from two places, like internal and external sources. And also the information collected from internal sources we call primary data, while the information gathered from outside reference to called secondary data for data analysis. And it all must be collected thoroughly, primary or secondary research in epidemiology.
Listed on the screen there. So how does epidemiology fit with traditional medical care? Well, epidemiology focuses on population groups, whereas clinical medicine really focuses on individuals. Epidemiology also focuses on prevention, where clinical medicine focuses on treatment. So both are focused on improving health, but they view the patient very differently.
Yes, so it is very important, okay? Very important. So like I said, there's so many people not possible to go to the doctor for clinical medicine, right? So many population under the poverty or low income, but epidemiology give you a broad spectrum, okay? And also the clinical medicine particularly covered the it is the study of the highly technical medical subject or practice the experience of medicine. It is individual, but epidemiology is a general population. They do the study in general population. So basically, epidemiology help to prevention the disease, but clinical medicine do not do this.
Is on treatment. So both are focused on improving health, but they view the patient very differently. And so when we work in prevention, we work in 3 different levels, the first of which is primary prevention. And the focus here is not allowing the disease to occur in the first place. We do this by risk reduction and focusing on behavioral change and through education and immunization. Secondary prevention.
So particularly this is the question NCLEX would frequently asking. What are the different kind of prevention? What are the example of prevention, right? So prevention, the state are the predominantly prevention of the diseases, or primary prevention. We categorize as primary prevention, secondary prevention, and tertiary prevention. Okay. Also, sometimes we use combined, and this strategies not only the aim to the prevention onset of disease, solely the risk reduction. Okay, so I said every prevention and example is important. Okay, it is called disease prevention. I said primary prevention, it is intervention before the health effect occur thoroughly. Secondary prevention, particularly we go for the test or scanning to identify the disease is early. And tertiary prevention means managing the disease post-diagnosis to slow down, to stop the disease process. That 3 different things. So again, I said we have to know what are the different level of prevention, are many categories, or as I say, we also discuss about the prodromal, primary, second, and tertiary prevention.
And the focus here is not allowing the disease to occur in the first place. We do this by risk reduction and focusing on behavioral change and through education and immunization. Secondary prevention focuses on not allowing the disease to continue or progress. And so our focus is on finding an illness early so that it can be treated early. So we do screenings and we treat diseases so that they don't progress. Tertiary prevention restores a patient to their optimal level of health. And so we do this through rehabilitation and support groups.
Okay, so what are the importance of disease prevention? So health promotion and disease prevention program can empower the individual to make their choice and reduce their risks of disease and disability. These are main importance of disease prevention. Okay, and also it can eliminate the health, any sickness, or improve the quality of life, and also improve the availabilities of health care or health related services.
These 3 levels of prevention fit in with the goals of Healthy People 2020, which has a goal of preventing disease and disability and death from infectious diseases, including vaccine preventable diseases. And you can see some of their efforts listed there. So people working in community health definitely have their work cut out for them. But epidemiology gives them the means to identify where to put their scarce public health dollars.
Okay, but here is important to know I
them
said
the means to identify
healthy population 2020 goal. The goal to prevent the disease, disabilities, and death from infection diseases include vaccine and preventable disease control. Disease preventable thoroughly universal vaccination, or disease preventable thoroughly target vaccination or infection diseases, and also emerging the antimicrobial resistant. Vaccine coverage and strategies, also vaccine safety. So this is the goal in Healthy People 2020. But 2020 is over. What are the next? The next, we are going to focus healthy population 2030. So healthy population 2030, basically the goal are attained the healthy or also a healthy life or well-being or free of preventable disease, free of disability or injuries, and also stop the premature death. So this is the new elements of Healthy People 2030. So elimination the health disparities or achieve the health equality, and also attend the health literacy to improve the health and well-being for all. This is the next goal for 2030.